A big success for the American Cancer Society. The annual Making Strides Against Breast Cancer 5K walk was held in Orange County yesterday, but the fight it goes on today. There's new research just out now on how sitting too much increases the risk of women getting cancer. Dr. Rebecca Alleyne is a breast cancer surgeon and an ACS volunteer. We want to welcome the doctor to the newscast. And doctor, what I was just reading there right now about sitting too much, what's up with that?
Yes, so as we know, most Americans now are living a pretty sedentary lifestyle. We don't have to even walk to the mailroom at work anymore. Everything's electronic. Take long commutes, get home, don't exercise. But what we recommend is getting 150 minutes of exercise every week. So if you break that down, it comes out to about 30 minutes, 5 days a week.
That's not too bad. And also eating a plant-based diet helps out as well, right? What exactly does that mean for people who don't know?
Absolutely. So we want you to eat fruits and vegetables, preferably fresh, not canned or frozen. And there are some recommendations that say get 5 servings a day of fruits and vegetables, but we'd really prefer you get 9. And that sounds difficult to do, but if you switch out something like pasta for maybe a squash or zucchini and then put the pasta sauce on it, that's a good way to get them in there.
Little steps, right?
Correct.
So you're seeing patients every week come into your office dealing with breast cancer, very serious. I guess for those new patients, it's good to know that there are all these different progress. There's a lot of progress in breast cancer, isn't that right?
Yes, there is. From my point of view, the surgical point of view, we're actually able to do less and less. We used to have to take out 10 or 20 lymph nodes from underneath a patient's arm to stage the breast cancer to see how far it's progressed, and that caused a lot of pain.
Yeah.
It could cause swelling. Now, if a woman is keeping her breast, is not having a mastectomy, but just taking the tumor out, we can do a special test called a sentinel lymph node biopsy and just take out between 3 and 5, preferably, lymph nodes, and there's not as much risk of that arm swelling.
Gotcha. And we're actually watching now video, doctor, of yesterday's 5K. So many smiling faces there. It's great to see that there are so many survivors, aren't there?
Yes, and the survival rates are going up. That's mostly due to my colleagues in the medical oncology side. The chemotherapy is getting a lot more specific, a lot more targeted, and more women and men, because men can get breast cancer too, are living longer.
How do you see the future of breast cancer and cancer in general? Do you see there being less instances of it, more instances of it, or just better treatment, better ways to deal with it?
I think we're going to start off with better treatment. There's a sort of a new trend in cancer treatment now called genomics, where we're looking at really specific details on each patient's cancer cells and targeting the treatments towards those details, towards whatever protein pops up on the cell, things like that.
Is that like the BRCA gene or something like that?
BRCA
gene,
yeah, BRCA. And everybody has the BRCA gene. It's like a spell checker. It just corrects mistakes in your cells. But in people who have the gene that Angelina Jolie had, they have a mistake in that gene, and your spell checker doesn't work. So you get mistakes in the DNA, and those lead to cancer.
Okay. Doctor, thank you so much. So informative. There's always something to learn from this. Thank you so much. For more information about the American Cancer Society making strides against cancer, go to kcal9.com and click Seen on TV.